You're rolling.
Okay. Well, good afternoon. Welcome to the Albemarle Charlottesville Historical Society October online program. Two pandemics, 2 centuries, 1 town, 1918 versus 2020. We have Addeane Caelleigh and Dr. Michael Dickens with us, who are going to be doing a conversation in regards to the pandemic. Just a few housekeeping items to cover up front. We are streaming this on Zoom and Facebook Live. For those joining on Zoom, you have all been muted for the time being. Maybe later we'll open it up for questions, but now we want to focus on the conversation at hand. The chat box is open, so if you want to pull the chat box up to the right-hand side, you can see all the other participants, and you can also submit questions or comments as we go along with the program into the chat box. As I said, we'll have a question and answer period at the end so that we can hopefully answer your questions and look at your comments. Those joining on Facebook Live, we'll keep an eye on that. You can add comments, questions into the comment section there. And then we'll bring them into the Zoom setting here. And we'll try our best to answer all your questions that we receive. And if not, we can follow up after the program. Is there a way to turn off the bell when people enter? Yeah, that's one thing we need to figure out. Thanks, Gene, for that. My name again is Tom Chapman. I'm the Executive Director for the Albemarle Charlottesville Historical Society. I am new here, though being here for 6 months is considered new in a COVID world. I began working here on April 1st. It's been a crazy and eventful few months. Trying to lay out a path for the society in this new socially distanced COVID Zoom world we find ourselves in. Ask you all to keep an eye out for our fall newsletter that actually went out in the mail yesterday and today. We can also email the newsletter. So if you're not sure if you're in our email list, type it in your chat box, type your email into the chat box, and we'll send a newsletter to you. You can private chat me if you don't want to have everyone else who's participating see your email. Lots of information in that newsletter, what we've been up to the past few months, our plans, calendar of events. You can also check out our website where our calendar events is also found. Website is still under the construction, but it will be opening very soon. And in our upcoming November program, I'll be providing a State of the Society presentation. But enough about that. I'm really looking forward to this program because of its relevance, how we can look to the past to help us understand what we now face as a community with COVID-19. One of the first people I reached out to when I took this job was Addeane with the program idea many months ago, and I'm so glad that's our first official online event. Our program this afternoon is an interview with Addeane Caelleigh and by Dr. Michael Dickens. Dr. Mike is an honors graduate at Princeton University, received his MD from Columbia University, completed his residency here at UVA. He was a practicing pediatric physician in Charlottesville for 35 years. And in retirement, he volunteers for the society as an author, a researcher, an interpreter of history, amongst his many other accomplishments. Addeane is retired from the UVA School of Medicine, where she was a researcher and curriculum developer. She was a past editor of Academic Medicine, the Journal of the Association of American Medical Colleges. And as it pertains most directly to this program, Addeane authored an article in our 2017 magazine of Albemarle County history titled The Influenza Pandemic of 1918-1919 in Albemarle County and Charlottesville. The Publications Committee for the Historical Society unanimously awarded her her essay, the Jane Moore Essay Award. And I'd like to take this time just to recognize this achievement. Here is your award of certificate, Addeane. I would also like to note Addeane's generosity. She has graciously taken her $500 reward prize and donated it back to the society. So thank you very much, Addeane. To everyone enjoying our program this afternoon, please remember that as a nonprofit organization, we rely on the support of our members, and even more so in this new COVID Zoom world that we find ourselves in. Every donation, every member makes a difference. I would much rather be meeting you all in person, but until that day comes when we can do that safely, we're going to venture into this new online live programming and do the best we can. So with all that said, again, thanks for joining us this afternoon for our program, Two Pandemics, Two Centuries, One Town, 1918 versus 2020. And with that, hand this off to Mike and Addeane.
Well, good afternoon, everyone. Again, my name is Mike Dickens, and I want to welcome you to this first effort at providing a program on the current and past epidemics. Just to reassure you, since I'm not wearing a mask, I am sitting in a large room all by myself. I can't see any other human beings in any direction, but in case they happen to come in, I do have a mask that I can put on. But currently I'm practicing social distancing, and I even have a can of hand sanitizer just in case. We're going to be talking about two different epidemics, and as they occurred in one community, our community of Charlesville, Albemarle. I think it should be remembered that even though most of our comments will be about influenza, the current epidemic that we're all experiencing is not an influenza epidemic, it's a coronavirus epidemic, and the viruses are somewhat different, but their social effect has so many similarities that that's what makes it such an interesting program. So I'm going to act as the interrogator, sort of, and ask Addeane a series of questions. She truly is the expert on what happened in our community 100 years ago with the 1918-19 epidemic. And the first question I have for Addeane is, how in the world did you get interested in this subject?
Well, for many years now, I've been interested in how societies deal with extreme events. And quite often my reading led me to natural disasters, hurricanes and earthquakes and things like that, but increasingly to medically related emergencies. And so that quickly led me to the influenza epidemic, as well as a couple of other epidemics. But I very much enjoyed researching locally something that was such a world-shattering pandemic.
It should be pointed out that Addeane has a very distinguished background. She was the editor of Academic Medicine, which is the journal of the Association of Medical Colleges in the United States. And so she's well qualified to do this. And I wanted to ask you a follow-up question. How did you actually go about researching the topic? What tools did you use that you found helpful in your research? Because we are the Historical Society, and one of our goals is to provide tools for people who are interested in doing all sorts of historical research. So I'd like to find out how you actually went about getting this knowledge.
Well, one of the first places I went was the Historical Society Library. I sort of eased my way into it that way. And there are several tools there that I found very useful. I did some research about burials, thinking I could identify some grave sites related to the influenza epidemic, for example. I used something called a city directory. They used to be very valuable tools for understanding what was available in a city, and Charlottesville had one. So I could look up people by name and get their addresses, and I could look up like a yellow pages. I could look up drugstores, for example, and find how many there were and where they were located and that sort of thing. I spent a great deal of time in the university special collections archives, many days there, as well as the historical collections in the university's health science library. And then I have a library of books There was nothing written about what happened locally, and there's never been a book about what happened in Virginia. If it had been earlier in my life and career, I probably would have wanted to tackle a book about the state as a whole, but that seemed beyond me at this stage.
Well, I understand you had access to patient information logs at UVA, which had not previously been looked at by anyone. Is that right? Tell us about that.
Yes, that's right. And in fact, under previous HIPAA restrictions, I would not have been allowed to see those logs. These were the logs of the ledgers of patients who came into the hospital, and their names and some other information was entered in the ledger. But there had recently been an exception to the closed records rules that said that as long as you didn't look at personal identification information, even for something 100 years old, that you could look at the names, for example, and get counts. And so I did that. The people there were very helpful at helping me set up to mask the things I was not allowed to see and to see the things that were legal for me to look at. But that shows how far patient confidentiality goes in medical records these days.
Yeah. I wasn't aware that it, that it would pertain to people who had passed so long ago, but I guess there are reasonable exceptions to it.
Mm-hmm.
In terms of the product, your article in the magazine of Albemarle County History, which I'm holding up here, was volume 17. If anybody at the end of our discussion has a thirst for more knowledge, I'd strongly advise you to go and read Addeane's article, because it's very thorough and in-depth and very informative. Let's turn the topic to the subject of the 1918 versus 2020 pandemics. Currently the pandemic that we're going through, I looked it up this morning. It's easy to find out what's going on with the current pandemic. You just turn on any television station or look at any newspaper, and you have all this blizzard of charts and tables of information. But it looks like currently, around the world, there have been over 40 million cases of the coronavirus and something over 1 million deaths. We've had 8 million cases in the United States and 221,000 deaths as of this morning. And in Virginia, I think it's up to 167,000 cases so far, with 3,457 deaths as of this morning. But of course, we're not through this epidemic. Those numbers, the meter just keeps clicking as the days go by. So I don't think any of us know where this is going to end. But I'd like to ask you to talk about the metrics of the 1918-19 pandemic. Talk about the numbers and give us some scope of what that was like then.
Sure. Well, the pandemic lasted the pandemic came in 3 waves, and the first one was a relatively mild form, lasted about 3 days. It was quite debilitating. It was very contagious, but it did pass. But right behind it came the virulent form, and that's the one that we think of with the high death counts and case counts. So overall, in just a few months, in basically 6 or 7 months, almost 700,000 Americans died of influenza. And if we compared that to today, given our population growth, that would be 2 million people. It was a catastrophe.
Yeah.
And then locally, if the proportions were the same, today we would have 2,000 deaths here in Charlottesville, Albemarle County alone. And right now we're in the 70s. We have slightly over 70 deaths in the whole health district.
Which includes more than Charlesville and Albemarle.
Pardon?
That includes even more than Charlesville and Albemarle. Yeah.
Absolutely.
Yeah.
Whereas it would take 2,000 in Charlottesville, Albemarle alone to be the equivalent of what happened. I'm estimating that approximately 400 people died in Charlottesville, Albemarle, and that's a very conservative estimate. That's based on death certificates I have, and then applying those ratios to the larger rural population.
Right.
The city of Charlottesville was about 10,000 people, and the county was 20,000 people. And so there are very few death certificates from the county, the rural areas in the county. And so we have to just speculate on what those deaths would have been. But I'm estimating conservatively that 400 people died. And that doesn't sound like very much, but it was a very large
It's a
number
large percentage.
size of the population. Yeah.
And not everybody who died then probably had a death certificate filed. So
No.
that number
Only
is a
people who were
conservative.
seeing a doctor.
Yeah.
Yeah, and so many people apparently died in Charlottesville who weren't under doctor's care, but especially out in the county in the rural areas, and there were no doctors. And of course, there's also the idea of who could afford to pay for a doctor.
Right.
But most people were cared for at home, and most people who died at home.
Right.
Almost everyone who died of influenza in 1918, 1919 died at home.
And you know, I think we have to remember there were some other fundamental differences. I don't believe there were nursing homes then.
No.
I understand it. So one of the big centers of disease spread that we see now, and I was looking at the table this morning from the Virginia Department of Health, that a lot of the fatalities are centered around nursing home clusters. So that was not a phenomenon then. So people were dying individually at home in small family clusters rather than in large groups. And that means that it was probably a much more virulent disease at that point. Do you have any feel for, and this may not be answerable, but what percentage of families lost a loved one?
That's nothing I can answer locally or nationally. It's not every family, because it's very clear that some families came through intact. And I don't think there was any way to know why one family would have no fatalities or only one, and the people next door would have several.
Yeah.
It just happened that way.
Yeah.
But there were definitely people, there were families in which there would be more people ill in the house at the same time than there were people to take care of them.
Right. I remember
Neighbors stepped in, families, church members, that sort of thing.
Of course, they were used to doing that kind of thing in those days. I mean, most people who got sick didn't go to the doctor unless they were really, really ill.
Right.
And so neighbors took care of neighbors.
Mm-hmm.
But I do remember reading one case of the gentleman who was delivering food to the neighbor family and leaving it on their doorstep. And then they would come out and get the food and bring it in and return the empty food basket to him. So there was this social distancing going on even then, even though they were trying to be good neighbors.
People did understand how this was, how the contagion worked. And that's because the same mechanism applied for tuberculosis, which was an absolute scourge at that time, and ordinary influenza. People were very used to influenza going through the community. That was no surprise. It was just how bad this influenza was.
Because there'd been influenza epidemics on a regular basis for decades and perhaps centuries before this one came along.
Yes.
Right.
Yeah, no question.
Yeah.
It's just this one was ferocious.
Right. Well, wasn't there some speculation that something mutated in the virus between that mild first wave and the really virulent second wave that set it off? I mean, that it changed slightly in that brief interval?
That's my understanding. Now, I don't have the scientific and clinical background on this, but from my reading, that's what I understand. And they think that the mutation occurred in Kansas. Now, there have been some other theories put forward, but the one that's most often accepted is that it started in Kansas and that the virus would have leapt from a pig to humans, although there's a lot of talk about that, but that this was another case of a virus moving from an animal species to humans.
So it's not really fair to call this the Spanish flu then, is it? We should call it something else, the Kansas flu or something like that.
Or something like that. No, there's a curious story as to why it's called Spanish flu. And this was at the height of the First World War. And that will come up again about the effect of the war.
Right.
But, and there was censorship in all of the countries that were at war. But Spain was a neutral, and so they published stories in their newspapers about this epidemic. And so people began to call it the Spanish flu, and the name stuck. So even today, you'll see books in which the title is Spanish flu.
But it really, the Spaniards are off the hook. I mean, it really came from somewhere else.
Yes.
But it seems to be sort of traditional for us to try and blame someone else for our woes. And so you see names like the Hong Kong flu, the China virus, so forth and so on. Well, the reason I ask you the question about the percentage of families that died is I remember growing up, my mother's older sister had been 18 years old when the war started in the United States. And she had been engaged to one of those doughboys who went off, and he went to the training camp at Camp Gordon outside Atlanta, where I was raised. And he died from influenza before he even went overseas. And I think it sort of permanently changed her. She mentioned it a number of times. There was like a sadness in her that never left. And so the memory of that epidemic, it's the old empty chair phenomenon they used to talk about after the Civil War, the person in the family who's missing. And so I think that the epidemic, even after it passed, because of it had such a high death rate, had a lingering effect on the psychology and the emotional well-being of the community. When did the epidemic actually start in Charlottesville, and how long did it last? And talk about, was it seasonal like influenza is expected to be now?
For the first part of it, I was able to identify all the death certificates for Charlottesville and Albemarle County for the entire period of the influenza epidemic. So I could sort out people who were dying of other things versus the people who were dying of influenza. And then I could do some ordinary counting and things like that. The first death certificate from influenza that I found was September 30th. And it was a young man from Scottsville. As I think I remember he was a carpenter. And it lasted until February and March. And it had really tapered off in the late winter. Like there were very few cases in February, for example, and virtually none in March. But in October and November, there is this spike of deaths. And you can see it in a chart. I did a small chart of what it looked like. And there were two waves of this bad form of influenza. And one was the great big one in October and November. And then it tapered off, and then it spiked again and was about half as big the second time. And then it fell off rapidly. So that's the kind of pattern that you get. And there doesn't seem to be any reason I understand why it tapered off in November. I don't think of November as being such cold weather, for example.
Well, do you think that, I remember there was a certain amount of angst here in Charlottesville when the university was about to open up again a few weeks ago about whether all the students coming back into town would be importing the coronavirus into our city. And do you think that is it possible that the university in 1918 that they, ended their session in November? Did they send all the students home over the Christmas break? And is that one of the factors that caused the decline? And
No,
then when they came back,
the university closed earlier than that.
oh, they
Okay,
did.
they sent
Yeah.
everybody home when this started.
So sometime in October.
Mhm.
Yeah.
Or even September, because you see, it was raging through the whole country. So it's not as if it was a secret of what was happening in other parts of the country. The newspapers were carrying information. Even the Charlottesville newspaper carried some national news. So, and the governor asked that the 2 medical schools in the state close so that their students and professors would be free to help deal with the influenza. And so some students did volunteer. In fact, one student at UVA volunteered in the hospital and died of influenza.
Hmm.
Mhm.
Wow.
Yeah.
Well, that brings up, since we don't really know why there was that decline in cases in November, December, only to have it come back again in January, that brings up one of the things that maybe should be thought about in comparing to our current pandemic is, as we're entering the same time of year that they were experiencing influenza, is that we don't really know what's going to happen because this is a different virus.
Mhm.
And any hope that it's going to change seasonally, I think, is, we just don't know. And hopefully it will go away, but that's not known yet. Could you talk a little bit about the population characteristics of those who actually got sick and died? What was the target population in terms of age and gender and so forth?
Well, this pandemic had, meaning the 1918 pandemic, had a different pattern than usual. With so many diseases, it's the very, very young and the very elderly who bear the brunt of the disease, and the young adults are better able to handle the disease, evidently. There was a different pattern for influenza in that it was healthy adults that bore the brunt of it, so that people in their 20s and 30s died proportionally in larger numbers than either end of the spectrum. And this had a particular, an unusual effect in that it left orphans. It left more orphans than normally. And the first orphanage in Charlottesville was created to take care of orphans from influenza who had no family members to take them in. Because, of course, mostly what happened is that orphan children would be taken in by family members.
Right.
But there were, I think it was 8 who had no family to take them. And so the first orphanage was created in Charlottesville.
Well, what's the reason they speculate as to why this particular strain of influenza attacked young adults as opposed to older adults? Why was it so different from other strains?
I really don't know. I know what I've read. Many people actually died of pneumonia.
Right.
Because they got pneumonia as a secondary infection, and the understanding is they died of the pneumonia before the influenza got them, in a sense. But we think of pneumonia as more a disease of the elderly at that time.
Right.
And so I don't really know. Some researchers have talked about the idea that what happened is that the body overreacted to dealing with this novel virus, and that actually it was the body's reaction itself that killed the patient. And so if you think of younger people or midlife people having stronger immune systems, then that would mean that they would react more strongly, and therefore the numbers would be greater for that group. Now, I don't understand the ins and outs of that, and Mike, you probably do. Isn't that what's called a cytokine storm?
Yeah, it's the same phenomenon they're talking about with the coronavirus, and it's certainly logical. I think it's hard to, at this distance, that we'll ever really know the answer to that. But the other theory I've heard, which is also logical, I think, is that, you know, we would experience as a society influenza epidemics on a regular basis, and there was a fairly significant epidemic in the late 1880s, around 1890. And one theory is that the people who were born prior to that epidemic and caught that form of the flu developed an immunity to it. So that when they were in their middle to later years in 1918, they already had a partial immunity to a similar strain of the flu. So when the pandemic flu came along, they were protected. Whereas the younger adults and children who'd not been alive in the 1880s had no personal immunological exposure to a similar strain, and therefore had no built-in immunity. And that's logical. Whether that's really true or not, I don't know. I know they did actually isolate the 1918 virus from some frozen bodies in Alaska in a Native American village up there, and the CDC actually reconstructed the 1918 virus. So I think there's ongoing research now about how related that is to the previous viruses or to subsequent viruses. And it's a very technical subject, as you know, or as we all know. They have to make a new vaccine every year because the virus just constantly mutates. It's very pesky that way. It's always trying to get past our defense mechanism. So, but this particular one was exceedingly dangerous. And one of the things I read was that it had the ability to multiply and divide in your system very rapidly. The turnover rate was very quick. And but a lot of the patients who died did get that secondary pneumonia you talked about, which was bacterial. And I think one of the things they didn't really understand at that time was the difference between viral and bacterial diseases. They understood what bacteria were. They could see them under their microscopes. They knew there was something else that was infectious, but they did not have electron microscopy. So no one had ever isolated the virus at that point in the sense of being able to identify what it looked like and to categorize them. So they were really operating in the dark in terms of the difference between viral and bacterial diseases. What about racial differences? Did you pick up any information in your research about different effects on different racial groups in Charlottesville?
Well, in terms of the death certificates I have, and remember, that's only a small part of the total number of deaths in our community, but dealing with the death certificates, I can say that about 29% of the population in Charlottesville, and also just about that same number in the county, were African Americans. But with in those death certificates, 40% of the death certificates were for African Americans. So clearly there's a disparity here. Now, whether that's reflected out in the county, I do not know. And of course, I can only speculate as to why that disparity may have occurred. And it seems to me that it's the usual explanations, that perhaps poor health because of less access to physicians or other health services would play a role. There may have been different demographics on the proportion of African Americans with certain morbid conditions. The morbidity patterns would be different between Blacks and whites. We just don't know, but that's based only on the death certificates I had, but it stands out pretty starkly.
So there was an excess of deaths among the African American community. compared to the white community. Yeah. Well,
Uh,
you and I
is
talked about this.
29%. Pardon?
Sorry, say that again. I talked over you.
40% as opposed to 29% of the population.
Okay.
40% of the deaths, 29% of the
So
population.
that's about a 1/3 more deaths among the African Americans compared to 29.
Yes, a quarter to a third, right.
Yeah, right. Well, you and I talked a little bit about this in that interview we did on Channel 29, but one of my theories is that, the medical care that was available then really didn't make any difference to the outcome.
Right.
I mean, they didn't have antibiotics, they didn't have vaccines. The kind of care that was available really would not have affected your risk of dying. I think the difference probably for the African American community was something, not an access to care problem, but basic deficiency in nutrition, general health, children and young people who are malnourished, their immune systems don't function as efficiently. They're more susceptible to secondary infections, and that may well have been the deciding factor for that population, but it's hard to know again at this distance. So this may also not have been something you could tell, but I was wondering if this was more of a rural or urban disease. Obviously, it's going to be more likely in a crowded city than somebody living out on their farm in the county, but was this something that was limited to just the city, or were people also experiencing it out in the farther reaches of the county?
Oh, I'm just assuming it was everywhere because there were some people in very small villages who had access to doctors. I could see those death certificates, and they were dying of influenza. And remember, you mentioned the story about the family where the neighbors brought food and left it on the front porch. That's from very isolated Western Albemarle,
Right.
for example. Now, granted, one family with deaths
Right.
doesn't tell us anything, but I am assuming based on what happened in the rest of the country that there were a significant number of deaths in rural areas.
So that's just a reflection of how incredibly contagious the illness was. Yeah. Because, when you think about Charlesville in 1918, 19, not only was it a much smaller town, but the ability to travel was so much more limited. There was no interstate system. The roads out into the county were pretty primitive, as I understand it. There was no passenger air service. So people didn't mix by moving around as much as they do now. And yet the virus was able to work its way around that and infect those areas that were more remote.
Well, one thing we need to remember is the role of railroads. And
Right.
Charlottesville was connected to every place in Virginia and every place regionally by the railroad. And one of the things that was very clear as I did this research is the ability of people to travel locally using the railroad. So for example, when in my article, I gave a fairly long list of the different ways in which people came to be in Charlottesville and die of influenza. And so sometimes it would be someone who was traveling, happened to be in Charlottesville, caught influenza and died. Sometimes it would be a Charlottesville resident who would go to another city for whatever reason and die there. Family members would take the train and go to be with a family member who was ill with influenza in another city, sometimes going to help their college students. We've got 2 or 3 examples of that. And in Richmond, for example, the relationship with Camp Lee, which was very close, there were so many people traveling back and forth because of the military people being trained. It was a big training center that the city, anyway, there were attempts to keep the soldiers on the camp, in the camp, and there were efforts to keep civilians from going into the camp because there were such high rates of infection
Right.
inside the camp. It was seen as a real, we would say, super spreader environment
Right.
today.
Super spreader.
Yeah.
They're
Yeah.
all living in the same barracks room. Yeah.
All
Well, you
of
know,
that.
Tom Chapman, who introduced this program, and I, we worked together at Montpelier for a number of years, and I used to do some tours up there. And I remember standing in the train station at Montpelier, and they used to have 17 passenger trains a day up and down that main Southern Railroad line between Charlesville and Orange and on up toward Alexandria and DC, 17 a day. And
I
when
had
you drive,
no idea there were so many.
yeah. And when you drive up to Orange, you know, there are those little side roads, kind of like Gilbert Station Road and Burnley Station Road. Those little roads go down to where there used to be passenger stations. So there were like 3 passenger stations between here and Orange, where the trains would stop and people would get on and off. So it was much more like a commuter railroad system like you'd see in a big city, like the Long Island Railroad in New York today, or the Metropolitan Railroad in Chicago. So you're absolutely right. I think that the railroads were a vector of disease, to put it in modern infectious disease terms. You know, it was a real vector. Let's talk about the Charlottesville community. How was it organized to deal with contagious disease? Maybe talk about the use of volunteers and how did it address the epidemic as a community?
Well, that's one of the best set of stories that came out from my research. And I was very interested to see how that worked. There are 2 things I think people will find particularly interesting. One was that Charlottesville had what was called a visiting nurse assigned to Charlottesville. Some of those were paid for by the state government and some of them were paid for by the Red Cross. But they would live in the community and work toward public health, dealing with public health issues. And so Ann Harris was the district nurse assigned to Charlottesville. And to back up just a minute, just a year or so before, there had been a big fundraising effort to buy a car for her to use so she would spend less time traveling back and forth to see patients. And that happened just before the epidemic hit. And so it was considered fortuitous that she had this car, that she and her volunteers would have this car. There were people who stepped forward to work with her to deal with strangers. So people were taking care of their family members, they were taking care of their neighbors, and then some of them, really brave, actually worked with the district nurse, going to houses where patients were and trying to help her deal with nursing the sick. So I think that's a good story. Another thing that people did, and this was true all over the country, was that volunteers would provide food, because in households with some households were just overwhelmed and there was no way to keep up with providing food for members of the family. So see, sometimes neighbors would step in and help with that, but there was a community-wide effort to provide food for people in this situation. And so some people cooked food and donated it, and volunteers delivered it. In other cases, people provided ingredients. And here's an interesting twist to the story. Those donated ingredients were sent to Nanny Cox Jackson, who was the domestic sciences teacher at the colored graded school. That was its formal name. It's now called the Jefferson School. And she and her volunteers would make soup, healthy soup, almost like stew, and then some of those volunteers would deliver it. And so this is something about people just coming together on their own and helping to provide for their neighbors.
Well, in talking about volunteers, let's talk about our favorite subject, currently masks. As I understand it, there was an effort among the ladies of the community to to get together to make masks for everybody?
Yes, it was the local Red Cross chapter. Most cities and even some small towns had Red Cross chapters. And so they put aside, that chapter put aside the projects that it had been working on and made masks for people. And they did that until there was, their meetings were closed down. People were not supposed to meet in large social groups. And so I couldn't read anything in my records as to whether people, the women, continued to make masks on their own at home, but I'm just assuming they did. It's just they didn't get together in their meeting room and all work together. Now, how many people actually wore masks? I don't know. These days we see lots of pictures from back then of people in masks. And sometimes it's very clear that's a domestic group, it's a family, and they're all wearing masks. A lot of the pictures you see were staged. So you may have seen one of people getting on a streetcar in a big city, and the conductor is wearing a mask, and the people getting on are wearing a mask, and the conductor is shaking his finger at people, so they'll wear their masks. And you see other pictures like that, and they were staged as public health messages. But it's very clear from diaries and things like that nationally that a lot of people wore masks, but there were no mandates anywhere that I know of requiring wearing masks.
And like today, there was some pushback on that, wasn't there?
I think there was some pushback,
Yeah.
yes, but most of it may have just been passive. People just didn't wear a mask.
Well, one thing that occurred to me was back then, probably the vast majority of adults smoked as opposed to now. And it's just as a practical thing, it's hard to imagine maintaining much discipline about wearing masks if you're constantly, thinking about your next cigarette. That's sort of a grim thought, but nevertheless, it occurred to me. But I did find in talking about anti-masks, this is from the Charlesville Daily Progress. It's a report. I don't know if people can see it, but there's an anti-mask meeting. This was actually in San Francisco now. This was not in Charlottesville.
I wondered how I missed it. That's such a wonderful.
Right, but so there were places where people just thought it was an infringement of their liberties, and even though the message was consistent from the public health people that they should wear masks. I'd like to, we've got a limited amount of time left, and this is really interesting, but I'd like to talk a little bit about the bigger world picture and how that affected Charlottesville. Most people know Civil War history and World War II history, but a lot of people don't know World War I history. And if the first cases showed up in Charlottesville around October 1, or maybe that last week in September, that was exactly the time that the American Army launched the great offensive in the Battle of the Muse, Argonne. It was the single largest battle ever fought by the United States Army in any war ever. Mm-hmm. And so the effect of the war was really had a major impact. And not only did it crowd news of the epidemic off the front page of the paper, because how could you ignore something as big as the doughboys are going over the top, they're going to free Europe, that people paid attention to that. But could you talk a little bit about the effect? I know you've mentioned it a little bit, but the effect of the fact that World War I was at its height from an American perspective at the very same time that the epidemic hit.
Well, two things are worth noting just right away. And one is that because there were these hundreds of thousands of American soldiers in military installations all over the country, meant that when the epidemic got to them, it spread rapidly. Everyone crowded up together. Then they were put on troop ships, and the troop ships had everybody closed in together for day after day on their way to Europe. And then when they get to Europe, they're all crammed up together, getting to the front to fight. And so you can see what that has to do with the infection rate, and then the death rate among soldiers at various places. Now, I need to sidetrack just a minute to make a point, and that is that because of the war effort, President Woodrow Wilson made 2 or 3 fateful decisions. And one was that he would not stop sending troops to Europe, which, that would have been very surprising if he tried to do that. And so that led to a high death count on the ships, for example. It was a big problem. But secondly, he forbade federal entities from releasing data about the influenza pandemic. So the Public Health Service, for example, did not issue any statistics, and the Army did not issue any statistics overall. And that meant that news about what was happening was limited to what could be read in the newspaper and what you could see around you. So if you were in Philadelphia, for example, which was one of the hardest hit places in the United States, you knew it was an absolute catastrophe because of what you were seeing around you. When you were in Charlottesville, you knew that it was very, very bad, but you probably didn't know how bad it was every place else because there wasn't that much in the Daily Progress. So that's another effect of the war, that the president and some of the leadership was so concerned about wartime morale that they just kept the lid on a lot of information about influenza. The president made no statements about influenza of any kind during the entire pandemic, for example.
That suppression of information carried over to Wilson himself, because
yes,
one of the things I had the opportunity to do was to read the medical records and private correspondence of Wilson's White House doctor, who was a Navy admiral from Virginia called Cary Grayson. And it was clear that Wilson very likely had influenza in the spring of 1919 while he was in Paris negotiating the Paris Peace Accords. And during that time, and shortly thereafter for a while, he was mentally deranged. He was hallucinating, and yet this was an effect of him having a very severe case of influenza. And not a word of that leaked into the press.
That's a very long tradition in terms of president's health.
Yeah, right.
Kennedy, for example, and his severe health problems and the drugs he took and things like that.
Right. Well, the other thing about the war, and then we'll change subjects, is there were war bond rallies going on in Charlesville, weren't there? The efforts to sell Liberty bonds.
But there were no parades or anything like that here.
Were there gatherings to try and get people to buy the bonds, or?
Not that I can see during the period of the pandemic. So okay, if there had been any before that, then I didn't pick that up because I didn't go back far enough.
Okay.
But right, there weren't any during the months of the pandemic.
Of October.
But in some places, one of the worst things that happened in Philadelphia was that they did not cancel a huge parade for war bonds, and the disease exploded in Philadelphia. Philadelphia is the only place in the United States where they had to do mass burials. They had to use, what do you call them? They dug the graves mechanically.
Yeah.
Common
grave, yeah.
Hard grave, anyway.
Yeah.
And they had to dig them and just lay the bodies in the trenches.
Right.
It was so bad, but that's the worst hit.
I can remember those pictures of those war bond parades, with Wilson and other dignitaries marching down the street in an effort to, sell Liberty bonds, and right in the middle of the epidemic. So we are beginning to run out of time. Of course, they didn't have vaccines, and they didn't really have any effective proven medical treatments, but there were people trying to sell medicines in an effort to try and treat the disease. Can you talk a little bit about that and how that was conducted in Charlottesville?
Well, the pharmacies, there were either 4 or 5 pharmacies, all of them on Main Street or right downtown in the downtown area. And they ran ads in the Daily Progress. And so what you would see sometimes, well, more usually, is that a product that had been available for things like regular influenza or colds or some things like that would now be advertised as useful for Spanish flu.
Even though it had not been tested against the flu.
Of course not. So the one I'm thinking about right now is Vicks Vapor Rub.
Right.
I don't know if any of our participants today know about that, but it was advertised as effective for Spanish flu.
This is the ad. I actually brought it with me.
Oh, did you?
Yes, right. And it's clever because the way it's printed, it looks like a news story. And when I first saw it, it's got a headline and a subheadline, and it looks, and it reads like a news story. But then when you get into it, you realize it's a paid advertisement from the Vicks company. And what they're saying is that there's a great shortage of Vicks Vapor Rub, this wonderful product. And this is, they're going to limit people to only so many jars per household and so forth. But really, it was just an effort to get them to buy Vicks Vapor Rub, which is a wonderful product for other reasons, but still. Well, the one thing I did notice,
you get various things like that being advertised, and they say good for Spanish flu. And sometimes it's something that's supposed to build up your system,
right.
And sometimes it's things that are supposed to help you recover.
Right.
And there were, as you and I have talked about, there were people who sort of hucksters,
right,
who tried to sell snake oil as helpful with Spanish influenza. So
my favorite one was this one that was there was a Dr. Flanagan, who I guess was the health commissioner in Richmond,
right,
and he sent a warning out to newspapers, which they printed the article in the Daily Progress, that some man was engaged in selling a preparation which is called quinine, which is alleged to be a cure for the disease, which is raging just now. Now, quinine, of course, is the molecular precursor of hydroxychloroquine. And so, 100 years later, here we are with the same thing going on, but people were trying to make a buck out of selling unproven cures. And I just thought there was an interesting coincidence there.
Well, the U.S. Public Health Service had no resources or facilities to help localities and all of this, but they gave advice.
Right,
and so the Surgeon General was quoted in newspapers all the time. And the Public Health Service also issued statements saying, trust your doctor, take medicines your doctor provides for you. Don't go buy these false products.
Right. Which is a little different than saying trust the science, because there wasn't a lot of science involved.
Well, at the time, it was seen that there was science.
Yeah, they understood the value.
We know that some of it would make no difference, but they at the time didn't know.
Right. Well, I think we're getting close to an hour, so I think we've exhausted our time, Addeane. This has really been interesting and fun talking.
I do have a couple of questions
there
I can add to the mix.
Good.
Okay.
One from Paul Johnson. Did the 1918 pandemic have 3 waves or was it 4 waves?
Well, some people count a later wave that came after 1919. There's one in 1929, for example, but there would be cases, little blips of influenza in various places, but it's usually seen as 3 waves. The first one was the milder form. The second one was the new virulent form. And then the third wave was a milder spike, a shorter spike of the virulent form. So I don't know, maybe there are some sources that identify a 4th wave, but I'm not familiar with that.
Yeah, I'm not familiar with that either, but I wouldn't be surprised.
Yeah.
Okay, hope that answers your question out there. There's one from a Eberhard Jail. Hopefully I pronounced that correctly. Might there be quote unquote excess death estimates for the Seville Albemarle area for 1918, 1919? I believe nationwide that was the only year in US history that the population dropped. He also followed up with a 2019 population growth, slowest in century, an NPR link. So I'm guessing he's trying to think that even though what you were saying, Addeane, in terms of underrepresenting because of death certificates, but at least in terms of, I guess, statistical analysis of population, that we probably were looking at something pretty major if we had no population growth.
Yes, I'm just assuming that's correct. And I know that demographers dealt with national data, and you can really see life expectancy. There's this enormous dip in overall life expectancy because of the deaths from the pandemic, the 1918-19 pandemic.
The other thing to answer the question, this may be directly related perhaps, but there was a change in the law in Virginia between the first wave of the epidemic and the second and third waves, that during the first wave, influenza was not a reportable disease. You know, when I was practicing pediatrics, if I saw a case of measles or whatever, I would have to call the health department and tell them that I'd had a case so they could track. It was basically they could track the prevalence of various infectious diseases in the community. Well, in the first wave, influenza was not on the list, but by the second and third wave, it was. So that would affect some statistical analysis, I think, because the information wasn't being routinely collected until they realized they had a major problem on their hands.
Well, and in the military, when that first wave went through, the milder form, which, you know, just affected so very many people, the military was also dealing with an outbreak of measles. So they were dealing with two things at a time: highly contagious measles, highly contagious H1N1 influenza.
Right. Which was typical for every army and every society throughout history. Whenever you put the troops together, there's going to be trouble.
I have a question from a Facebook watcher, Lisa Asogba. If I have a death certificate for my great-grandmother that says pneumonia in 1918, can I conclude she had Spanish influenza?
What month
I
was
don't
it?
think so. I'm sorry, you go ahead. My answer historically is no, there's a good chance it was just plain pneumonia.
Yeah, well, the first question I asked is what month did she die?
Yes.
You know, if she died the second week or third week in October, I might be a bit more suspicious than if it had been the previous April.
Right. What you often see in our local death certificates is influenza-pneumonia.
Yeah.
And I counted all of those as influenza. You know, in my counting, I was very conservative. It had to say influenza before I counted it as influenza. Now, there were a couple of other terms for influenza, and I counted all of them as pandemic influenza, for example.
And the other thing for the questioner to remember is that, of course, there was no treatment for pneumonia of any sort in 1918. So if you were an elderly person and you caught a bacterial pneumonia, you were much more likely to die from it. And so Addeane is absolutely right. It's hard to draw any conclusion.
Okay. Well, I hope, Lisa, that helps kind of point you in a direction there. And I asked her the question if she can give us a month, it might help us. I also received a pronunciation direction. Caelleigh is the pronunciation of that name. I messed up. Eberhard Caelleigh. So sorry, sir. Question from Lisa Bittner. Where was the orphanage that you mentioned? Where was it located in Charlottesville, Albemarle?
Ooh, I looked that up a few years ago. I think it's roughly where the Market Street parking garage is.
Right. That's called the Meade.
Don't-
That's the Meade property. That was the Meade property, wasn't it?
I don't know. And I'm sorry, you can't trust that answer, but I did look it up at one time and that's roughly where I thought it was.
Reverend Richard Kidder Meade of Christ Episcopal Church, when he retired from the church, opened a girls' school right where the downtown parking garage is. And that ran for a number of years until he died in the mid 1890s. And then that was my understanding that they took that property called the Meade property and turned it into the orphanage, which makes sense. Because it was a residential school for kids before that.
Yeah.
Okay. Lisa also follows up with a couple more questions here. Wasn't there a quarantine of the general city of Charlottesville? I thought I heard that Freebridge area on Route 250 was closed, not allowing people to enter.
I came up with no information at all about any quarantine. The mayor mandated no large gatherings like church services, for example. Schools were closed for several weeks, things like that. But quarantine, no. There were no restrictions on travel that I could find.
Okay.
Of course, people then would have been much more accepting of quarantine because they did quarantine on an individual level, like a home would be quarantined if they had measles or some other highly infectious disease. But I agree with Addeane. I don't remember seeing anything that indicates that the city itself was quarantined.
Right.
And I think we talked a little bit about UVA in the presentation, but any knowledge of when UVA allowed students to return? Did they avoid the second wave?
No, they were closed for at least one whole academic year. But I'm sorry, I can't tell you when classes formally began again.
Okay, that was Lisa asking that again. Okay, thank you very much, Addeane. Jean Cooper asks, I think on behalf of maybe Kimberly Swanson, I believe I learned that German soldiers were housed out at Camp Albemarle, but was that during World War II? I was wondering if soldiers could have brought the virus into the area.
I think that was World War II.
I think so. There's no evidence that I saw of a large presence of soldiers in Charlottesville, for example. All the news came from Camp Lee, and that was reported on the front page of the Daily Progress just day after day after day about what was going on at Fort Lee, just as the major headlines had to do with killed and wounded in World War I in Europe, for example. So it was war news that dominated the front page of the newspaper, not influenza news here locally.
Yeah.
Okay, thank you. Hope that answers your question, Jean. She also asked a previous question when you were talking about recreating viruses, Mike. Isn't that dangerous? How do the scientists keep the virus from getting free?
Well, yes, it is dangerous, and they understood that, and the CDC was in charge of the effort. Once they obtained the tissue from the corpses, they had what was called a level 4 isolation lab. And they picked a scientist to work on it, and he was the only one allowed in the lab. And he had to undergo biometric security to get in. He could only work at night when everyone else was out of the building. So he was alone in there, and weeks went by as he was trying to rebuild the virus. And finally, when he was successful in rebuilding the virus, he sent out an email to the CDC staff, something like, he was playing a riff on the moon landing, it's one small step for mankind, one giant, or something like that. But the story is legendary, and they were extremely careful because they understood the risk involved, but they really wanted to find out what had made this particular virus so dangerous so that they could learn from it. Take steps to prevent it in the future.
All right, thank you. I was muted there. One more question from a Lois McKinn. Can you speak to the increased risk to pregnant women? Was there any during that time?
I don't have any information about that specifically in Charlottesville and Albemarle, but I do know that nationally there's national information. And yes, pregnant women were particularly at risk, apparently, and that having a bad case of the influenza also led to spontaneous abortions. And it was just one of the recognized features at the time.
Thank you, Dean. I think that's all the questions I had. If there's anybody else out there in Facebook or on Zoom, let me know, but I think I've touched upon all of them. Just wanted to add one little correction, Mike. There are 7 stops between Orange and Charlottesville.
7.
There was a lot of little communities along that line. And I just wanted to maybe ask one last question, kind of wrap it up in terms of looking into the past and understanding the 1918-1919 pandemic. We have 100 years to be able to look back and contextualize it and begin to make some comparisons to our current situation. But in the future, in terms of looking back at our current pandemic, do you think from our experience looking into the history of the Spanish influenza provided us any help in terms of understanding how to deal with what we're doing? Or are we just kind of repeating history?
Well, I think, what we hear from the public health officials now, the risk of being political, social distancing, masks, so forth, they knew all of that and they practiced that. They understood how dangerous the virus was, and the virus, of course, was relentless and will just keep taking advantage of the human race if we're lax about protecting ourselves. So hopefully we learned lessons from that, but we didn't learn any new tricks because they already knew the basic ways to try and fight the virus, which was the social isolation, masks, hand washing, so forth.
Well, one of the things I think we can see both then and now is that pandemics from new viruses are always a surprise, and you're never prepared for them.
But they will happen.
They will happen. And so the question is, how do you draw the line between preparing for nothing and thinking you can gear up, or on the other hand, being ready every minute and keeping all those resources there stockpiled and refreshed and all the rest of it, and doing that for years and years and years in between pandemics. But I think it's always going to be a surprise, and we're always in some ways going to have to start from scratch.
Well, I want to thank both Addeane and Mike for this very thoughtful conversation. I think very helpful to look back into the past to understand the surprises that we experienced and realize that maybe in some cases when we look at our current situation, it's very similar. And a lot of people joining in saying thank you, very educational. I'll put it out there again that if there's any interest in submitting your email, please do so privately, and I'll get you on the list so we can send our newsletter and other news announcements out. I'm assuming that many of you out there in Facebook and Zoom saw in one shape or form email or Facebook posting. So keep looking after that. And unless there's any last bits of wisdom from our Addeane or Mike, I will close up this meeting, and thank you very much for participating.
Thanks for having us.
Yes.
Y'all be safe out there. Take care.
Bye-bye.